Everyone, my name is Kishni Lovina Tyagarajan. I'm from Kuala Lumpur Metropolitan University College. Here I'm going to present my case study for neuro demography data. My case study's name is S and the age is 3 years old, 11 months and 10 days. Uh, and the date of birth is 1st February of 2013. Gender is female and religion Islam. Race Malay. Address she's staying at KL and her dominant hand is right hand. And the date of referral is 11 January 2017. And the purpose of referral is ADL training. And the diagnosis is cerebral palsy. What is cerebral palsy? Cerebral palsy is the general term for a number of neurological conditions that affect movement and coordination. Neurological conditions are caused by problems in the brain and nervous system. Specifically, cerebral palsy is caused by a problem in the part of the brain responsible for controlling the muscle. The condition can occur if the brain develops abnormal or is damaged before, during, or shortly after birth. Sign and symptom of cerebral palsy. The symptoms of cerebral palsy normally become apparent during the first 3 years of a child's life. A child with cerebral palsy may be slower in achieving important developmental goals such as learning to crawl, walk, or talk. The main symptom largely depends on the specific form of cerebral palsy a person has. The first four main types of cerebral palsy are the spastic cerebral palsy, kinesthetic cerebral palsy, ataxic cerebral palsy, and mixed cerebral palsy. The symptoms of cerebral palsy differ in severity from person to person. Some people only have mild problems, while others are severe disabled. The area affected by cerebral palsy can also vary. Some cases only affect one side of the body, some affect primarily the legs, and some affect both the arms and the legs. The spastic cerebral palsy is where the muscles are weak and stiff, hypertonic it's called, and especially if the moving themselves rapidly. Kinetic cerebral palsy is where muscle tone, the unconscious ability of the control or relax muscle, varies between stiffness and floppies hypotonics, and causes randomly and uncontrolled body movement or involuntary spasms or postures. Taxis cerebral palsy is where a person has balance or coordination problem, resulting in jerky or limbless movements. They may also experience tremor, involuntary shaking in their hands. Mixed cerebral palsy is where the person has feature of more than one of the type mentioned above. The causes is cerebral palsy is caused by a problem in the part of the brain responsible for controlling the movement. It can occur if the brain is damaged in the early life or develop abnormal. Although the extra cause is not always obvious, parts of the brain responsible for other important functions may also be affected such as communication, hearing, vision and the ability to learn. This is why people with cerebral palsy can have various other problems which don't involve the muscle. What causes the problem in the brain? In the past, doctors believed the cerebral palsy was usually caused by the brain damage uncertain during birth. The direct result of being temporarily deprived of oxygen aspirations. The aspirations can be sometimes occur during a difficulty or complicated birth. However, a major research project carried out in the 1980s showed that in baby born at the term, aspirations was responsibility for the less than 10% of cerebral palsy cases. Most were due to the problems which the brain that developed before a child was born. Research believe that are three main problems that can affect the brain before birth and cause cerebral palsy. That is PBL damage the brain, white matter, and abnormal development of the brain and interaction or hemorrhage and strokes. Personal history. patient name is S and she is 3 years old. She likes to eat spicy food like nasi lemak, spicy keropok like snacks and so on rather than the normal food like porridge or soup. If like sweet or something like semi-sec liquid, it's like she very rare to eat. She like more solid and sweet and or spicy. She spent her half of the day in the center because her parents sent her in the morning and fetch her in the evening. And her language is zero. She also likes to play with others by touching, and she easily get tired and poor endurance. She also a seeker attention and fear of the height. Family history: father, mother, and she. She is the only daughter for his parents. Socio-economical status. According to the patient parents, the financial of the family is normal and no problem about the supporting their child. Medical history. Patient does not take any medication presently and patient is in good in health. Social history. Pre-morbid. No eye contact, has do not like to make friends with others. She like to stay alone and stay at one place. And post-morbid, she trying to improve the eye contact even a limited time. She like to make friends with the peers in the therapy center. Educational. Presently, she taking special education class at the school that's situated in therapy center, and she also showing a good interest towards the educations. Evaluation. Objective assessment. A need more strengthening activities because her hand muscle is so weak and it affect her activities of daily living and ADLs. A will follow a parent's or therapist's instructions and poor in balance, zero language, and she need more prompts to complete her daily tasks. Objective assessment. The part 1 of the evaluation is occupation performance areas. There are two areas under the occupation performance areas, that is ADL and IADL, activities of daily living and instrumental of activities of daily living. The assessment that I use for to assess these two areas is the school function assessment. Function assessment for to assess the ADL, you can have a look on the assessment. The summary of the school function assessment for the ADL: she can't perform well his activities of daily living and the instrumental of it is of daily living without prompts because she have a very weak muscle. Second part of the evaluations, the occupation performance component, and under the occupation performance components there are the four areas that I assess, that is sensory, fine motor and gross motor, cognitive and social. For the sensory, the assessment that I use is sensory profile. For the second area, fine and gross motor, the assessment that I use is Peabody developmental motor scale. And the third area, the cognitive, the assessment that I use is school function assessment. And the fourth, the, the psychosocial, the assessment that I use is school function assessment. Sensory component, the sensory profile assessment. A. The auditory processing. She can't work with the background noise. She will easily distract from the noise because she covers her ears to avoid the noise sometimes, and also she will react depressed and she won't focus on her tasks. B. The visual processing. She becomes frustrated when they place her in the dark place. She will try to get out from the dark room, and she also becomes frustrated when trying things in a complicated background. Vestibular processing as seeks all kind of movement and this interferes with the daily routine, can't sit still. She likes to rock consciously in the chair during the class, even though she is not in balance. Tactile processing express distress during the grooming, like washing hand, combing hair, brushing teeth. But she like to touch others to make friend with others. But her self grooming activity is like she feel distracted and she avoid the grooming. Oral sensory processing. She shows strong preference for certain tastes like spicy and sweet things. Perception processing. She turns whole body to look at something or when her name is called and fear of the falling and a high place. Olfactory processing. Most of the time she smell her things before use the food before she eat. Summary of the sensory processing. Olfactory seeker behavior, tactile seeker, proprioception seeker behavior, oral seeker behavior, auditory seeker behavior, and vestibular seeking behavior. The last, visual avoider behavior. The second area find in the grass motor assessment P body developmental motor scale assessment. P body developmental motor scale has six subsets to assess the client motor scale, but I use four subset tests to measure my client. The four subsets are the stationary, locomotion, object manipulation, and the grasping. Stationary. This subset measure a child's ability to subtle the control of his or her body within its center of gravity and retain the equilibrium. As Ross score for stationary is 38 and her age of the stationary is 18 months. Locomotion. This subtest measurement a child's ability to move from one place to another. The action measure including crawling, walking, running, hopping, and jumping forward. Our raw score for the locomotion is 106 and her age of the locomotion is 23. Object manipulation. This subtest measure a child's ability to manipulate the balls. Example of the action measure including catching, throwing, kicking. Because these skills are not apparent until a child has reached the age of 11 months. This subtest is only given to children aged 12 months and older. As raw score for the object manipulation is 18 and her age of object manipulation is 23 months. The fourth assess part for the Peabody developmental, the grasping. These subtests measure a child's ability to use his or her hands in the beginning with the ability to hold an object with one hand and the progression up to action involving the controlled use of the fingers of both hands. As raw score for grasping is 40 and her age of grasping is 14 months. The third area cognitive function, the assessment that use school function assessment. You can have a look on the assessment that I carry out for the cognitive part. Summary of the cognitive school function assessment as need prompts to remind her performance, like works, where to place his things, what to do next, and etc. If not, she will like mingle around with the center and doing nothing and just stay at one place. The fourth area of the evaluation, the psychosocial, the school function assessment that I use for assess the social skills. You can have a look on the assessment form on the screen. Summary of the psychosocial school function assessment. As recently she trying to improve making friends with certain kids in the center, but she don't know how to make a friends and the way to make a friends, and she don't like to listen for therapist interaction instructions if they are not strict with her, and also therapists have to force her to do the works. She cannot cooperate with the therapist as well, everything based on her emotions. Problem identification. Occupation performance areas, the ADL. The problem is for ADL is unable to dress and undress her shirt. Occupation performance components. The sensory. The problem is poor imbalance. Fine motor and the gross motor. The problem is abnormal pencil grip. For the cognitive, the problem is unable to identify the body parts. The psychosocials, the problem is avoid the group activities. The intervention, the treatment plan and the goals for the activities of daily living. The short-term goal is S will be able to take off her shirt with minimal gesture prompts in 1 month. And the long-term goals is A will be able to put on her shirt independently with minimal verbal prompts in 3 months. Treatment plan and the goal for the sensory. The short-term goal is S will be able to reduce the fear of the balance herself in normal gravity is the floor with the independently in 1 month. Long-term goal S will be able to balance herself in normal gravity or high environment like on bench, beanbag, monkey paw, and etc., with minimal support in 3 months. The treatment plan and goals for the fine and gross motor. The short-term goals is S will be able to form a proper pencil grip with independently in 1 month. The long-term goal is S will be able to draw a circle, horizontal line, and vertical line with independently in 3 months. The treatment plan and the goal for the cognitive. Short-term goal is S will be able to identify the body parts with minimal gesture prompts in 1 month. The long-term goals is S will be able to identify the body parts with independently in 3 months. The treatment plan and the goal for the psychosocials. The short-term goals is S will be able to use yes and no appropriately. Say yes or no to the meal time like breakfast, lunch, dinner with minimal verbal prompts in 1 month. And the long-term goals is S will be able to use yes and no appropriately, like say yes or no to the mealtime, breakfast or lunch or dinner with independently in 3 months. Patient assets. As parents very support for us. As parents willing to take her daily to the center even they are tired or not feeling well or any problems. Still they are very responsible for send her kid to the center for her own kid. Model of practice person environment occupation PEO model. Through this model, it has been indicated that occupation performance results from the dynamic relationship between people, the occupation and the roles, and the environment in which they live, work, and play. In the client-centered approach, but equal emphasis is placed on the environment and the occupation where design intervention PEO define the person a dynamic or changing with a skill or ability to meet a role over the time. Environment including the physical, social, cultural and institutional factor that involve occupation performance. Occupation including self-care, productivity and the leisure. The frame of reference. Cognitive frame of reference is to assessing the level of cognitive functioning and providing tasks appropriately to the level. Aim, aims to describe the cognitive limitation caused by chronic illness. Identify the remaining functional abilities so the expectation of the clients are realistic. Sensory integration frame of reference. Purpose of the sensory integration frame of reference is to provide the evaluation and intervention designed to identify, prevent, and remediate defects related to the child's sensory perceptual skill, motor or paraxic skill, sensory sensitive, and related patterns of functional performance. These methods are used to achieve the overachievement goals of occupational therapy to improve the client's health and participation through the engagement in everyday activities or occupations. Rehabilitation frame of reference. The rehabilitation frame of reference, the independent is achieved through the adaptive device, orthotics, environmental modifications, wheelchair modification, ambulator aids, adapted procedures, and the safety education. The focus of this frame of reference is to enable the greatness amount the independence for the person in safely and in timely manner the completing the ideals, engaging in meaningful leisure occupation, and having the needs skills. Developmental frame of reference. The developmental frame of reference is based on the theory of human developmental in and across all the skills areas physical, cognitive, psychological, emotional, and psychosocial. The aim is to identify the highest level motor, social, cognitive skill in which a client can engage and facilitate an improvement in functioning from the starting point. The great activities so the child can achieve them, but it slightly challenge how to close the gap in the area in which the client is unable to perform. Humanetics frame of reference is considered about the individual view of life but takes more holistic perspective. In this frame of reference, change occurred through the relationships with others and it seems has virtue to complain with the treatment and ultimate the success of rehabilitations. Biomechanical frame of reference. Key reference to use these conjunctions is various other in enabling the OT to assess and identify the client occupational performance with various activities of daily living. Biomechanicals looks into a client's physical capacity such as movement, muscle, strength, and the endurance. Implementation. Problem 1. Unable to dress and undress her shirt. The treatment that given is training in ADL. The terminal behavior is child will able to dressing herself independently. The frame of reference that I use for this problem is rehabilitation frame of reference and the biomechanical frame of reference. The condition and the method that I use is the backward chaining. Trapeze assess the child to lay out the shirt and pull the shirt over the head and place each arm into the armhole and pull the sleeves over each arm and give the prompts get the dress. Child will pull the shirt down to the waist. The trapeze assists the child to lay out the shirt, pull the shirt over the head and pull each arm into the armhole and give a prompt get dressed. Child will pull the sleeve over the arm and pull the shirt down to the waist. The therapist asks the child to lay out the shirt, pull the shirt over the head, and give the prompt. Get dressed. Child will place each arm into the armhole and pull the sleeve over the each arm and pull the shirt down to the waist. Therapist will assess to lay out the shirt and give the prompts to get out the child. Pull the shirt over the head and place each arm into armhole and pull the sleeve over each arm and pull the shirt down to the waist. And when gives the prompt get dressed, child will lay out the shirt, pull the shirt over the head, place each arm into the armhole, pull the sleeve over each arm and pull the shirt down to the waist and generally to verify the materials and trapeze settings and the prompts. The categorization is for the beginner, no timing section. After the section, time is finished for 15 minutes. The rationale is if the child is able to dress and undress by herself, it will lessen the mother's burden because dressing is still a basics daily living activities more than other important so that the parents can focus or can give important to the things that child can also learn more basic things to complete works. It can develop the performance from the basic skill. The precaution is the environment should be free from the casual distractions. Problem number two is poor in the balance. The treatment that given is sensory integration therapy. The target behavior is increase the balance, and the frame of reference that I use for this problem is sensory integration frame of reference. And the condition and the method that I use is activity to improve the balance is walking over the bolster less than various heights, stair walking, slide up and down walking, walking on the bench for the balance and the coordination, walking on the bean bag, jumping on the trampoline, and hopping one foot by typing one leg. The rationale is balancing can improve her ADL and IADL because balance ourselves is important to do other works. Precaution. Environment should be secure and free from the casual distractions. Treatment plan. Problem number three, abnormal pencil grip. The treatment that used is positioning to prepare for gripping the pencil and writing. The terminal behavior is able to perform a proper pencil grip. The frame of reference that I use for this problem is biomechanical frame of reference, developmental frame of reference, and rehabilitation frame of reference. Cognitive condition and the method that I use is improve the muscle tone, improve the small muscle of the hand, working in the vertical positions help strengthening the whole arm which is an important foundation skill for writing. Heavy work activity develop an arm muscle, push up, crab walks, swinging in the trapeze so that the duration is for 30 minutes. The rational pencil grip can be used to help the child achieve a mature, effective, correct pencil grasp. It's important for child to develop a mature, effective, correct pencil grasp by going through the developmental appropriate stage of various pencil grasp sources. Precaution environment should be rescued and free for the casual distractions. Problem number four, unable to identify the body parts. The treatment that I use is acknowledge the child about the simple step with modeling to like pointing to the body parts, and the treatment behavior is able to identify the body parts, and the terminal behavior is they can able to identify the basic parts of the body that like eyes, nose, mouth, ears, head, hands and legs. The frame of reference that I use for this problem is developmental frame of reference and cognitive frame of reference. The condition and method is create a simple activity to develop the basic understanding steps of the body parts and guide all the activities that do every day pointing the body parts and give a rewards when he complete or she complete with any steps even though not enough. Encourage to do more works that can learn more things such as coloring, drawing, or songs related regarding to the body parts to improve identifications of the body parts. And the creation is any time and all the day can be do it. The rationale is by applying the basic step understanding, she can perform her works independently so that she can learn new and more about the studies. Understanding basic step will very meaningful because it can perform any other works outdoor there. The precaution is ensure the child understand the way of doing the education method, assist and supervise the child always, and ensure the instruction that given are simple and clear for the A. Problem number five, avoid the group activity. The problem. The treatment is group plan therapy and the group fun activity. The terminal behavior is to improve and increase the interest by joining the group activities. The frame of reference is the humanistic frame of reference, the developmental frame of reference, and the rehabilitation frame of reference. The condition the method that I use for this problem is child is able to sit appropriately and child is able to establish the eye contact, child is able to engage in isolatic toy play and child is able to engage in social mimicking play and demonstrate the appropriately actions and participation in the circle time after the afternoon together with the parents in the center. The criterion is 20 minutes to 30 minutes actually. And the rationale is the social or the group activity is an integral part in our life. Activities become more important when the kids have more leisure time when they group up. Every day, their participation in the different kind of activities include the self-care tasks, play tasks, leisure activity. Provide the activities have specific goals where the participation is volunteer and give happiness, meaningful activities, learning new things and relaxations and themselves and increase the social skill with others. The precaution is ensure the child is sit in proper positions and child enjoy the activities and ensure the instruction is clear and the simple. Programs encourage the patient to do practice writing. Educated the caregiver about dressing steps to teach the child. Encourage the patient and the parents to do activity at like wheelbarrow walk, push up to strengthening the hands. Educated the caregiver about some method to calm the child when they get too active during the home programs. Future plans to continue the treatment as above, to reassess the patient if possible, to visit the sham physical center again. Pronations as miss won't miss the appointment to come occupational therapy as mother able to follow the instruction given to her after the treatment section medication as is trying to balance herself in less high place right now the reference. Thank you for listening my case presentation. Thank you so much.